EKG technician duties and responsibilities. In electrocardiogram, EKG or ECG, technician plays a crucial role in the healthcare industry by assisting in the diagnosis and monitoring of heart conditions. Here's an in-depth look at their duties and responsibilities. Performing EKG tests. Preparing patients. Explanation. Explaining the EKG procedure to patients in a clear and reassuring manner to alleviate any anxiety they may have. Ensuring that the patient understands the importance of the test and how it will be conducted. Preparation. Preparing the patient by asking them to remove any clothing or accessories that could interfere with the EKG readings. Shaving and cleaning specific areas of the skin where electrodes will be attached to ensure optimal contact. Placing electrodes. Attachment. Carefully attaching electrodes to the patient's chest, arms, and legs. Ensuring that electrodes are placed in the correct anatomical locations to obtain accurate readings. Connection. Connecting the electrodes to the EKG machine, making sure that all leads are secure and functioning properly. Operating EKG machines. Operation. Operating the EKG machine to record the electrical activity of the heart. Monitoring the machine during the test to ensure it is working correctly and making adjustments as needed. Supervision. Supervising the test to ensure it is conducted smoothly and without any interruptions. Observing the patient for any signs of discomfort or distress. Monitoring and recording. Monitoring heart activity. Real-time observation. Observing the heart's activity on the EKG monitor in real time. Identifying and noting any irregularities or abnormalities in the heart's rhythm and electrical activity. Patient monitoring. Keeping an eye on the patient's physical condition during the test, especially if they are experiencing symptoms such as chest pain, shortness of breath, or dizziness. Recording results. Data collection. Printing out or electronically recording EKG results. Ensuring that the data is complete, accurate, and properly labeled with patient information. Documentation. Documenting the test results in the patient's medical record, including any observations or comments about the test. Analyzing and reporting. Preliminary analysis. Initial review. Reviewing the EKG results to identify any obvious abnormalities such as arrhythmias, ischemia, or other cardiac conditions. Making preliminary observations that can aid the interpreting physician. Collaboration. Collaborating with physicians to discuss any immediate concerns or findings that require urgent attention. Reporting findings. Report preparation. Preparing detailed reports of the EKG findings for the cardiologist or physician to review, including all necessary information such as patient history, test conditions, and any notable observations. Communication. Communicating findings clearly and promptly to the healthcare team, especially if any urgent issues are detected. Patient interaction. Explaining procedures. Clear communication. Explaining the EKG procedure to patients, answering any questions they may have, and addressing any concerns. Ensuring patients understand the importance of remaining still during the test. Reassurance. Providing reassurance and support to patients, especially those who may be anxious or nervous about the test. Patient comfort. Comfort measures. Ensuring patients are comfortable and at ease before, during, and after the test. Providing pillows or blankets if needed, and adjusting the environment to make them more comfortable. Post-test care. Offering assistance to patients after the test, such as helping them get dressed or providing water if they feel lightheaded. Maintaining equipment. Equipment maintenance. Regular inspection. Regularly inspecting and maintaining EKG machines to ensure they are in good working condition. Performing routine checks and calibrations as required. Technical issues. Troubleshooting and resolving minor technical issues. Reporting any significant problems to the appropriate department for repair. Sanitizing equipment. Cleaning protocols. Cleaning and sanitizing EKG equipment and accessories after each use to maintain hygiene standards and prevent cross-contamination. following infection control protocols strictly, supplies management, ensuring that sufficient supplies, such as electrodes and conductive gel, are always available and properly stored. Administrative tasks, scheduling appointments, coordination, coordinating with medical staff to schedule EKG tests for patients, managing the appointment calendar efficiently to minimize wait times and optimize workflow. Patient reminders, sending reminders to patients about their upcoming appointments and providing any necessary pre-test instructions. Patient records, record keeping, updating patient records with EKG results and relevant information, ensuring all documentation is accurate, up-to-date, and properly filed. Data entry, entering patient information and test results into electronic health records (EHR) systems accurately. The role of an EKG technician is essential in the diagnosis and monitoring of heart conditions. Their expertise in performing and recording EKG tests, coupled with their ability to interact compassionately with patients, makes them invaluable members of the healthcare team.